The topic I'm doing is schizophrenia. I chose schizophrenia because it was a topic I was interested in and wanted to learn more about it. So what is schizophrenia? Schizophrenia is a chronic brain disorder that affects thinking, emotion, and behavior. It affects almost 1% of the global population. The first indications of schizophrenia usually emerges in late adolescence and early adulthood. The main symptoms of schizophrenia include hallucinations, delusions, disorganized thinking, and negative symptoms such as social withdrawal. Causes and risk factors. So one of the causes is genetics. Identified genes often relate to the immune system, cytoskeletal development, and synaptic plasticity, highlighting their role in brain function. Heritability accounts for approximately 80% of schizophrenia, risk based on twin and family studies. A risk factor would be brain abnormality. The ventricles become more enlarged, which means there's a loss of brain tissue due to the spaces being bigger. The environmental factors, such as birth complications, early trauma, and urban living during childhood, interact with genetic risk to increase the chance of having schizophrenia. Both inherited and external factors contribute to the development of schizophrenia. The diagnosis and symptoms. Diagnosis is made using the DSM-5 criteria, requiring at least 2 of the following symptoms for a significant portion of 1 month, with some signs continuing for up to 6 months. So positive symptoms are normal cognitive processes. Hallucinations, delusions are 2 of the most common positive symptoms. Negative symptoms reflect a decrease or loss of normal functioning and can significantly impact an individual's ability to engage with the world. These include a lack of motivation, reduced emotional expression, and social withdrawal. Cognitive symptoms are less noticeable but still impactful. These include difficulties with working memory, which can impair one's ability to retain and process information. Altogether, these symptoms can make it difficult for those with schizophrenia to function effectively in society. Early diagnosis and treatment are critical in managing the disorder and improving long-term outcomes, but it is difficult due to how different everyone is with symptoms. The treatment is pharmacological treatment. First-line treatments include antipsychotics such as risperidone and aripiprazole, which mainly target dopamine pathways. Clozapine and second-line treatment is effective for treatment-resistant schizophrenia but requires regular monitoring due to potential side effects. Psychotherapy and supportive care, or CBT, helps patients manage hallucinations and delusions by challenging their irrational thoughts. Family therapy focuses on improving communication and reducing stress within families to prevent relapses. Advances in personalized medicine aim to tailor treatment to the individual's genetic and biological profile. From Feldman, 2024. Life impacts. People with schizophrenia often have trouble maintaining employment and social relationships due to cognitive and emotional impairments. The stigma remains a significant barrier, leading to social isolation and reluctance to seek help. Peer support programs, vocational training, and community integration efforts to play a crucial role in improving outcomes for people with schizophrenia. Research continues to focus on early detection and intervention, which could help prevent the progression of the disorder. Efforts to reduce stigma through education and advocacy are crucial for increasing public awareness and support. Martyr and Cannon, 2019, Feldman, 2024. The references I used were the Mark Bell Library, which was the Schizophrenia New England Journal of Medicine. I also used the McGraw-Hill textbook, Feldman RS Essentials of